Thank you, everybody, for coming to Digital Enabled Care for Elders, the 14th webinar in SenzMate's Connecting the Future series. And we're going to start in about 1 minute. We're just letting people come in. It takes a little while for people to flood in. And also, the LinkedIn Live is sometimes not perfectly well synced, so it's good to give it about a minute. We have 5 speakers. We're going to spotlight them one at a time. Each speaker has a certain theme they're going to be talking about. I'm here with my co-host, Miller. Miller, actually, you haven't been a co-host on one of these webinars for a while. You've been a speaker, I think, in the last 6 or 7. So now you're on the hot seat again, from start to end.
Hello, everyone. Pleasure to meet you again.
And we're going to be, by the way, just so for the LinkedIn Live people, welcome. We're going to be here on LinkedIn Live for the next hour. But when the LinkedIn Live event ends, we are continuing into an after party. And if you want to be part of the after party is on Zoom. And the reason why we have to do the after party on Zoom is in the after party, we're giving the camera and the microphone to the audience. You can't do that on LinkedIn. So we have to bring you in with us. So don't worry about it. If you're on LinkedIn Live, I know there's some people on Zoom webinar already. If you're on LinkedIn Live, there's a link in the chat that you can join us there. Miller, anything you want to add before we bring in the first speaker?
Maybe a little bit of housekeeping rules. So this call is completely recorded, everyone. So for all the audience today and for those who are registered for the event, everyone will be receiving a post-recorded edited version of this entire conversation. So please stay tuned and please be right there until the end. We have our after party, as Jose mentioned. Thank you, Jose. Over to you.
Okay. Our first speaker, joining us from the United Kingdom, Daniel, welcome.
Thank you, Jose. Thank you, Miller. It's good to be with you. I'm Daniel. I'm an independent consultant in social care. Until 7 years ago, I was head of business development at a care organization running home care, care homes, community care, and saw technology making a real difference in people's lives. So I jumped off and actually set up my own consultancy, working with a nascent, this is a year before COVID, 2019, working with a nascent, growing technology community in care. And since then, we've built up so much potential. So the question asked to me to start with was, why are we here? What's the whole point of this? I can set the basis for Jennifer, for Kelvin and Ruban and Arunn later. So why the demographic shift in the world is undeniable.
Hopefully, Daniel, you're not going about the life, why are we here, yes, in the earth. You're talking about it from technology.
Yes, definitely from a technology side, definitely. So the demographic side, the demographics is clear at the moment. We don't have, in that the fastest growing population is older people in the world. So our traditional care models are stretched. So what we need to do is we need to rethink care. We need to innovate carefully, bringing people in at every stage. So what I'm focusing on in the UK and now working internationally, I'm speaking next week at a conference in Abu Dhabi, is how we actually bring this greater accessibility of care at a time when people are being asked to empower themselves and take more care for themselves, how we can actually make care, still keep it personal and to people. So we have a real opportunity now to actually grow what we're doing, make what we're doing more efficient and effective for people, but without replacing humans, giving people with technology, giving people the possibilities of actually directing their own care and bringing in people when they want. So it's not about here, digital enabled care for elders. It's not about replacing people. It's helping people access a really accessible world. One of the first lessons when I started in care about 20 years ago was that if we make the world accessible for you and me, it makes it you, me, and the whole community. It makes it better for everybody. So if we build accessible places, if we have hearing facilities built into our infrastructure, it makes it open for everybody. So what we're doing now is with digital care, we're bridging the gap, bridging a critical gap where elders are being sometimes left aside in isolation, and we have a possibility to bring them into community, to make community around them, to use their experience in the world. So digital tools can offer this continuity and reassurance for people. It also gives us the opportunity to bring together all this data about people. And the beauty of data is it helps us plan. In the UK at the moment, we're going through a 3-stage shift of working from sickness to prevention, from hospital to community. And the embedding of this in neighbourhood services means that we can actually plan services to avoid people reaching an acute chronic stage, so we can actually be proactive in their care. So what we're doing with digital care, digital enabled care, is we're actually making it a more personalized system. So I take this example from banking. Banking over the past 20 years, if I want to make a transfer to Brazil at 3 a.m, I can do it. It's all around me. We want to bring that into care to make it personalized for the individual. So what I'm also saying is, if we bring this digitally enabled world in, it helps people who draw on care and support, and it also helps the people who are supporting them, be they professional care workers, family care workers, or other people in their care, their circle of care. So we can create this circle of care around people in a way and link them all by simple tools, simple communication tools. And what the last point I want to make to set off and hopefully give a base for the other speakers is that this is a time for leadership. We're creating a base on which a sort of legacy for future care, where we're going to take on the care possibilities and build on them. I give the example, for example, when driverless cars become a reality, and I believe in some states in the US they already are, but when they become a reality around the world, it will make the world accessible so anyone can access anywhere at any time and be in control of their own care. And that's what I want to achieve in the wider scale. Jose, so, I think that gives us something to work on. Ruben, you're coming in there.
Yeah, so Daniel, I mean, it is absolutely what you are set at the base, right? So one question to you on that part of it is, we talk about elder care, and means these people are a little bit older and they have various health issues maybe. What do you think about their adaptation or the resistance to the adaptation from those people? What do you see them struggling, or how we, or they are adapting it easily? I mean, it's curious to know from your point of view.
Great question. I think I want to turn that on its head, Ruben. Let's talk about inclusion rather than exclusion. One of the first lessons I always taught in care, let's talk about people's abilities, not their disabilities. Mm-hmm. So it's down to us as the tech gurus, the tech people, to make all this tech accessible. And that's what we're getting wrong at the moment. One word I really try and avoid is intuitive. Because what's intuitive? It's intuitive is, now if I see a 2-year-old now, they're on their iPad, they're on whatever, they get learning the skills. Intuitive is part of society. Our responsibility is to make sure that the technology that we're working on with people is accessible and inclusive. So you're right, there is that gap at the moment, but there's some research recently in the UK that even 25% of under 25-year-olds can't really adapt to the technology they're using. So it's about inclusion. So let's change the mindset here. Let's think about the inclusion, and then that starts you on the process. So I haven't answered the question fully, Ruben, but I'm getting there with this mindset change that we need to instill in how we progress.
Absolutely. We align a lot on that. So thank you.
Thank you so much, Daniel. We're bringing you back in about 40 minutes. And now, talking about thinking differently. And I think Jennifer, I interviewed you about 6 months ago. And actually, before I interviewed you, I saw some of your videos on LinkedIn, kind of like, oh. And I really liked your video. I think it was actually what really caught my eye was some of your videos on romance amongst older people, and which is not something like, oh, that we don't talk about that, but it's like, oh, you after I met you and I started thinking about how we care for older people and thinking about them differently, as opposed to just like, okay, we're just keeping them alive and comfortable. It's actually more than that. And you kind of opened my eyes with a lot of things. And in a lot of ways, it's kind of like they might need permission, or we could actually be kind of almost getting in the way, even though we're kind of good natured. Sorry, I'm getting away with myself here, but I'm wondering if you can introduce yourself.
Yeah, so happy to do it. Jose, thank you so much for inviting me to be a part of this really distinguished panel where all of us have a lot invested, I would say, intellectually, emotionally, financially, in our time into helping olders live a life that is more confident, more independent, more fulfilled, to extend their health span, and as you say, to extend even their love span. I love that you picked up on that. Thank you so much. What you're referencing is something that we've done in our company, which is, my company is called Viva Valet. And, to add a little meat to the bone of what Daniel just said is to talk about some numbers. When we talk about this ever-growing demographic blip that we see towards older age, every day in the United States, 10,000 people turn 65. And when we get to 2050, we're going to have 86 million people in the US alone who are above the age of 75. That's roughly the population of the size of Germany today. So we actually, all of us around our digital table and all of you who are watching today, we all are invested in finding ways to support our olders, either as a caregiver, myself, as an adult daughter, an adult child, or maybe we're an inventor, or maybe we're going to be an entrepreneur. And what you mentioned, I won't forget the thing about romance, because I do think this is a lovely thing to touch upon. And that's that we do something called Take Action Tuesday. So every Tuesday we do sort of a 1-minute TED Talk from the founders on what is that one thing during the week that you can do as a caregiver to support your olders. So I think you're addressing the Valentine's message, where a lot of our customers in our company, Viva Valet, which is a digital concierge service to enable olders to live at home by themselves independently with confidence, a lot of them are widows or widowers. And so you are looking at a Valentine's post that we had where when we'd been interviewing some of our customers and talking about their own journey of love after they'd become widows. And they said that the number one thing that enabled them to feel comfortable having a late in life romance and rediscovering love was to get the permission from their adult children. And so for those of you who are listening, thinking about how can you support your olders in their continuation of their own independence and their purpose and their joy, unlocking that, it's really to say, Mom or Dad, please know that we give you that permission and we want you to have that kind of life. Now, I have to be very careful, because I think you might have also seen that we did a talk on STIs amongst the olders as well. So if you do have an older father, the rates of STIs from unprotected sex as well as untreated symptomology is the largest in older men who are widowed, because we're seeing an explosion in chlamydia, HIV, gonorrhea in the United States alone. And so actually, I've had some people from NIH urge me to talk about this in these types of forums. So thank you for giving me space to talk about that, Jose. I think really building upon what Daniel said is, I really appreciate so much what you said about how do we design companies, solutions, support for olders, but I would also add the yes and there is with olders, as long as you're bringing them on the journey, and if it's a tech journey, bring them along to design with you. I had the great opportunity, I can't believe I can even say this out loud, but I had the great opportunity to advise the UN Secretary General together with AARP on their guidelines for inclusivity together with Microsoft and several universities and gerontologists in the United States, talking about if we're talking about the future of broadband access, if we're talking about the future of design for olders, what are the components that we see that must happen. And what we've seen time and time again from our own design journey, as well as working with our customers, is that regardless of the features that you may want to bring to market, or the tech, or I hear a lot about AI and robotics, and yes, all those things have place, the number one thing that will enable or kill your business is, can you demonstrate trust? So we're talking about, if we're designing something that's tech driven, have you established trust? That means, are you willing to invest in the human relationship? And if you're using AI, use that in the background. Use that to speed up your analytics, to help you be able to free time for the most expensive parts of your business, which is usually the human-to-human interaction. I know, Jose, you've said it. I know that Ruben, you've said it. I know, Daniel, you also say it's all about connections. How do we enable connections, purpose, so that olders feel like they're still able to live through their purpose and extend their health span, so that we have independence and confidence in their aging journey. So Jose, I know there's going to be a lot more questions, but I'll hand it back to you so we can continue on with the next person in our panel. Thank you so much.
Thank you so much, Jennifer. And I'm putting a YouTube link in the chat. And this is an interview I conducted with Jennifer a couple of months ago. I haven't forgotten it, and I've gone back to it. And thank you so much, Jennifer. We're putting you on the bench, and we're bringing you back in about 30 minutes. And I'm really glad you're here. We've got a really big, we might actually crest 200 people today, which is quite something. I'm not too sure, but we're going to be somewhere between 180 and 200 people. We've got an audience here on Zoom webinars, another audience on LinkedIn Live. Now, Kelvin, and some of you may have seen, we posted some videos, a video of Kelvin over the weekend, where he talked about his background in digital health transformation in hospitals, his own journey, what brought him to found MeCare, which was very, very inspiring. But I specifically, and I'm not, we might get that out of him in a little bit later on in the event, but I really want to talk to Kelvin about he's had a very interesting journey with product development, product discovery, research, zigging and zagging, pivoting, and to find out where he is. And I think it was a lot of people are building, or they're thinking about building, or they want to understand a bit better about how these solutions come to market. I really wanted, by the way, Kelvin, have I done a good job of introducing you? And I really wanted to zero in on that, because where you're at right now isn't where you started.
Absolutely.
Yeah. I wanted you to share that.
Yeah, thank you. So it's such a pleasure to be on this panel here. So thank you for the opportunity. Any opportunity I get to share our journey, I'm for it. So I'm Kelvin. For those who didn't see the video, I'm Kelvin. I'm the CEO and founder of MyCare. I'm also an associate professor in healthy aging with AI. And several panelists talk about some very important words here. So personalized. We heard Daniel talking about personalized. I'm going to cover this. But Jennifer also brought up something, which is trust. And when we looked at our demographics, and I have to say, thanks God, the baby boomers are turning 78 this year. So we have those now starting to enter the system that are used to technology. But when we started our journey, this was not the case, and we had to be able to bring trust among the technophobes, as I call it. So let's talk about personalized. So there are a lot of companies out there that can show evidence of health outcomes at quite a small level, but for them to be able to replicate what they've achieved in one region, irrespective of the socioeconomic background of a population, it's extremely hard. And if you have to deliver it at population health level, which is the magnitude of what we need to deliver, because if you look at the US, chronic conditions alone cost the health system about 4.1 trillion. This is more than the GDP of several countries in Europe. And for years, we've been trying to say, let's treat them at the hospital. But you can't keep doing the same thing and expect different results. And what if we can actually move from what I call sick care to health care? And the home for us is the place where we operate. So how can we reduce hospital readmissions, and how can we support the older adults that live alone at home to take care of themselves? And this is where, as a company, we look at the entire social determinant of health. We have the benefit of being a portfolio company of AARP, and we've had a lot of help from AARP. But let me tell you how we started. Bunch of data scientists from MIT, Cambridge University, Stanford coming together. We've got an idea. It's a great idea. We're going to build a thing. And we set off. We build something. And then we push it out and realize, well, nobody wants to use it. And what's going on? We've done our research. The aging population putting a lot of pressure on the system. We built something that would prevent them from going into the system, but we're not getting stickiness. And this is where very quickly we realized that we need to start from the end user, because providers, insurance companies may buy your product, but very soon they will realize that's not value, that's not a good investment if the end users are not actually using it. Now, for the end users to use it, for me, I have the three-prong approach. It has to be simple to use, it has to be affordable, and it also has to be accessible. So those are the three things you need to start. But with AARP, what we then did was to talk to the users to really understand what drives value for them. Now, make no mistake, value to the end user is a very different type of value to the actual payer. So for the payer, and someone wise once told me, focus on solving real problems and creating real value for your customers to create lasting success. And that is something that stuck into our mind. And we had to really understand what is value. So if someone who lives alone at home, what is value? They're looking for companionship. Are they interested that you have technology that if they have a fall, they talk to an AI and the AI will call someone? Not really. That's not what's bringing the utility. That's not what's delighting them. What's delighting them is that companionship, because loneliness is for them where the problem is, not the fact that the hospital system, Medicare, Medicaid, are not able to cope with the pressure. That's for them, that's not where the problem is. Their problem is they live alone at home, they don't have any companionship. That is the problem that you need to be able to solve for them. So through AARP, we had the privilege of reaching out to over 7,500 people to really ask them, how can we bring value to your life? What role technology can play in your life? And this is where we very quickly understood what is it they are actually looking for. And when you start to then take the needs of your user and you bring that as part of the design process, and when you co-create with your end user, this is where the magic happens, because it helps you to understand where to spend your money, your resource on things that really matters to them. And starting from the client, the older adults, and then moving upstream and solving the problem for providers as well. And then lastly, you start to work on the technology. So if you use that sort of cycle of client, patient, provider, insurance, provider, and then you go up to the right technology for them. You cannot get it wrong. And we've had the privilege of understanding the European market as well as the US market. They're very different. One is a capitated model and one is a fee-for-service model. So one is after savings, another one is after ROI. But that's a kind of different topic altogether. But for me, that the bit of research that we did to get the level of adoption and building trust was what changed our company drastically. Now, when I'm talking about doing the research, this is not only pre-product launch. What I did as a founder after we've done the product, I spent time with all the adults, having a cup of tea and seeing how they're interacting with our conversational AI and how our conversational AI behaves when there is a visitor in the house. And this then allowed me to also kind of close that feedback loop, because you build a product, you've been informed by a group, you launch the product, the journey doesn't stop here. You have to keep improving your product, and you have to keep gathering the feedback of your user so you can actually improve and better optimize your product to create that level of personalization and also to build the trust that Jennifer talked about. And you'll be amazed how much change that would bring to a company if the client and the user trust your product. Not easy to achieve, but once you achieve this, you're on a different pathway.
Hey, Kelvin, thanks for that absolute, detailed analysis, and it could see where you come from. Your background is in, I think consulting and all that earlier part of it, and you came into that. I want to ask you a question on, you started in UK with NIH and you got things in going. Then you jumped across the pond to come to US and able to do, incrementally work and working with Mayo Clinic and various aspects of it. Can you just talk about that transition? Is there any difference between what you saw in UK versus US? Because these two are big market and that can be adapted to others.
Yeah, thank you, Ruben. Yeah, it's a very different market. So when we started the company, one thing that I always like to do, Mike is not my first rodeo, not my first company. It's about build something and prove value in your local market and do it really well. And this is what we've done. And then we were able to reduce hospital readmission by about 77%. That went on Sky News. And then AARP saw this video, and then they invited us to come to the US to talk to them. And we thought, wow, US, big market. So that's it, we've done it. But then when we started to look at the ecosystem, comparing the UK health system and the US health system, I say that by the time I understand the health system in the US, I'll probably have had an exit already, because it's so complex, so fragmented, but also the model is very different. UK is more like value-based care. It's more capitated, so you have a fixed budget. And US, it's fee-for-service. So you can't reduce people going to the hospital because now the ROI is going to go down. So no hospital would be wanting to give a contract. So it's about changing that mindset, but also scale. In the UK, we have, with the NHS, we can have a contract for about 1,000 patients. In the US, it's about 10,000 patients. So as a company, can you deliver at that scale? And again, what we've learned, if you have the slightest doubt of being able to deliver at that scale, say no, you can't. Because what we've also learned, US compared to UK is extremely litigious. So if you cannot deliver, say thank you very much, we'll talk to you in 1 year when you can deliver. But it was a very different model, very different experience. But also we had the benefit that a lot of my co-founders are US based. So it's not like we started from ground zero. We had a bit of insight of the market. They are from the US.
Thank you.
Thank you. And actually, I want to say my own comment. I'm hoping to month is just before I think we announced the webinar, and then after we announced the webinar, I've actually been spending a lot of time visiting relatives in hospital and in care homes in northern Spain, and really what you said, Kelvin, really resonated with me, because when they're in hospital, so one of them was in hospital, first thing is she wanted out. She wanted to go home. But when she was in hospital, mostly just wanted to talk to people. And when she went home, she wanted that sense of occasion. Like, we're not just here to visit her because she's been injured. And you mentioned that about having somebody over and having this device, creating that sense of occasion to spark a conversation, and really, 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 really resonated with me. And also I'm Ruben, I'm going to let you speak in a minute because you're next, is when at the very beginning, and I never brought it up, when Daniel and Jennifer were talking about communication, enabling people, a lot of them, I know their main source of communication is a flip phone and a little black book. And when you get to be, and they're outside and it's windy, and that little black book has 200 pages and it has 800 phone numbers in it, and their eyesight's not very good, it's very difficult for a lot of them, like, how they can communicate with their carers. And that becomes a barrier, and then they don't feel as comfortable going outside. So I wanted to add that.
Yeah, and the point as well here, when we talk about care, we normally just think of the older adult and their physician and their clinician, but that's not the case. They have such an army, their grandchildren, their children, their neighbor. And for me, when you're looking at care as a whole, you need to look at it as an ecosystem. So how do you bring the neighbor in the picture? Can the neighbor help in a particular way? You have volunteers and third sector organization, and we call it like social prescribing. There are people that are willing to do it for free, but they don't know who needs their help. And the older adult don't know who might be able to come in. They only need someone sometimes just to have a cup of tea. That's it, and that will make their day.
It's that little black book. Thank you so much, Kelvin. We're going to bring you back. And we had a great turnout for this ribbon. I think this is the biggest one yet. And do you want anything to add before we go to our final speaker?
Yeah, I mean, the part of it which I bring normally to this table is I sit in the Silicon Valley. I invest in a lot of the companies in this area, in medical and various aspects of it. One of the area which I have found was, I think earlier Daniel was talking about the banking. We are talking about with Uber, the taxi life got changed completely. And you can look at it, agriculture, which, SenzMate participates in some of these areas. So there are so many of those areas got changed. But if you look at the medical part of the field, it always had a barrier because of the privacy, because of the data sharing. Because even though it has the humongous amount of data, it has challenge of how do you use that data, because when you look at the technology point of view, the LLMs and all of them, Arun would talk about it, how we program all of those. But to do that, you need to access to the data. And there are limitations because of HIPAA in the US side, and there is other, I'm sure there are European side of it also have that one. So as I look through this industry last 10, 20 years, some of the transformation, it happened early, I think 2010s, where digitizing the data and requirement for every hospitals to have the data side of it. So that gave, from an investment point of view, technology point of view, access to this information to go and start analyzing the data and where we can use the technology. I mean, we had some of the earliest webinars on pharmaceutical research, where we found some medicine which was, just like, a few of these, hair and the Viagra's and all these things were found because it was, invented for something else, and they found it has a lot of other effect part of it. So it's a similar thing. So as a technologist, what we look at it is, look at this data, how does that applicable to this industry? And the way we look at it, because Jose bring me from a financial aspect of it is, as I think Kelvin and few others talked about, how many $1 trillion are spent on that. And our GDP, our, as aging population comes into play, one side of it is people, family, and the money side of it. The other side of it, the caregivers, because you don't have this many caregivers to support these people. And the second part of it, the caregivers are not paid as, generously. Because of that, a lot of people go into different field to work on it. So how do you use the technology with that limited amount of resources available, but even to give a better solution? So that is where we are talking about the junction between the technology and the elder care need, because it is absolutely needed, because as the baby boomers come out of it, there are so much needed. And then there are younger population. Used to be, you can go and care for these family, care for these people, but what happened is they need to have their own kids, they need to take care of their own family, and they may have to migrate to different place because of the job and different area part of it. So how do you remotely, because if you look at the technology, some of the thing Kelvin has done as well as others have done, including Jennifer, because if you look at it, how you can do remotely analyze this information. And I can give you a great example, quick example of it. One of them is, my mother is in Sri Lanka, all of our kids are across the globe. Now we have technology to monitor her, understand her, and we have a nurse who can, find the daily information. And my brother is on top of it, always looking at it and say, okay, just make sure we call the doctor, may call this one and all that. That's one of them. And the other one is, which I just came back from Botswana in Africa after visiting my family. And I think one of the early people we had is called Jogo Health, which SenzMate have helped develop their remote thing. So there was a Parkinson patient. He couldn't hold a pen, he couldn't hold a fork and eat and all that. And we got him into that program. He went through that about a year. I was with him last week, and he's eating. We were in a resort, in a safari resort. He's eating food and all that. He's about 70, 75 years old, and he's able to get to that level of thing. He was thanking me for introducing me to this technology, and it was basically invented in New York and developed in India and delivered to South Africa. Think about the global level of this, technology moving around and helping people. So I want to stop there, because I think, I will be available for question and answer later, but it is important of connecting the business requirement and financial need with the what technology can deliver to the patients. That is the most important part.
Thank you, Ruben. I call that the view from the 30th floor. Thank you so much. And we're going to bringing Ruben back during the after party. We have one more speaker. And welcome. Ruben, I wonder if you could
Hello.
I wonder if you could close off before we go to the after party. Can you give us a picture of what technology can do now, what it can't, how should people think about it? Because I think I want to set this up. I have to tell this story, and I know this might be. When I was visiting my uncle. One thing I noticed is there was a person at the care home who just waits by computers. He waits by the phone. He's got the CCTV. He's got the email. He's mostly just waiting. And they just have all these screens, and there's usually nothing happening. But they're not consolidated. So you're just he's just waiting there, and he could be doing something.
Yeah.
But it's just kind of like the way the technology is consolidated is we just stick a person here with all the screens. And there's so much better must be possible. And
Yes.
I wonder if you could share some thoughts.
Yeah. Thank you, Ashay. So we had chance to work with the elder homes facilities as part of SenzCare. So we worked with their management and then go there and see where are they facing issues and like what we can do to improve things by using the technology. Especially in the start of the LLM era, we focused on how these generative technologies can be helpful in improving their way they are providing care. So what we gathered from them is lot of their time, especially we visited the homes in UK. So a lot of their times, especially the carers' time is going into like note taking and optimizing the note, planning care. So it takes a lot of time rather than the real care. And so there are a lot of regulations and there are a lot of documentation needed. And also the staffs, like, so there is rotation of staff, there are shifts, and some staffs are only employed for a short time. So they don't have the full memory. So, and they don't have full knowledge about the particular person. Sometimes they have to read a lot of documentation, and there is no consistency in providing the care. So provide a solution to this. We build a elder care system. It's a elder intelligence, what we call, with the help of technologies like knowledge graph and LLMs and agentic approaches. So our system's core is this elder intelligence. So it knows how to take notes, how to improve notes, how to plan care for the next 2 weeks or next month, how to summarize the notes, care notes, and if a particular carer needs some guidance on how to handle a particular case, it can provide solution. So that's the core. But how we implement that solution is, so we provided the carers mobile app, so they can just enter the observation and our system can optimize it, like ask other questions to get the missing information or optimizing the care note taking, and get the 360 view of the elderly person, like the profile, and it can automatically generate the care planning for the next 2 weeks. So which will reduce a lot of time from the care nurses and like give a like personalized plan for each elders, but without much readings and planning. So that's the core system we developed. So it will be saving time. It will be providing personalized care planning while maintaining the quality. So always there is like transparency on how this system works, on which data the system works, and always we maintain the privacy. We have encryption and hiding the personalized information when we are transferring between systems. Because another issue we've identified is, so there are a lot of systems on not taking, storing information about elders, but there is no centralized view. How to integrate different systems and give a centralized view, like a dashboard, a 360 dashboard for each elders, and how to provide a personalized care. Yeah, so that's what we built here.
You stay for the after party.
Yeah.
We're going
I'll
to
be
start in about 15 minutes. And
Yeah,
I'll
sure.
bring everybody. This is the group hug. Here we go. I could say Hollywood Squares, but I think that'd be, I don't think people in the UK or Europe will understand what Hollywood Squares is. Let's see, we missing somebody? We got everybody.
Miller is
There you
out
go,
there.
Miller. Miller, do you want to add something? Because I know you've been.
I'm waiting for more use cases to be shared in the after party, Jose. So let's have the group hack and continue the discussion on the after party.
We've had a lot in the chat, and this is something that's because we've done a lot of these events now. We get people. The conversation is different. People are kind of you don't see so many question marks until the after party. People save their questions. We have a lot of people who are going to be coming forward with their use cases and talking about them. And I wonder, let's see if I can bring attendees.
But
Jennifer,
while
you want to
you're
add
doing
something?
it,
I
I
always would love to add something if it's okay.
Please, go ahead.
go ahead,
But
Jennifer.
I just think what a distinguished panel, what an incredible, rich array of insights that we all have from working with olders and in service of olders to help their lives be better. And we all have this consensus of helping them live at home independently with confidence. So what a fantastic thing to be a part of. So thank you all for raising your voices. I wanted to speak about something that Kelvin talked about, where you were talking about work, in service of your customers, in service of your olders, really to understand who they are. And you'd said that you designed this masterful suite of services and tech, and you found that you were having a difficult time having uptake until you had to pivot. And I think that's one of the common things that we see in this area when I'm talking to other founders is they're asking me the same thing. Why can't I I've made this cool thing for the elderly. Why aren't they using it? And so I think one of the things that we really have mastered and we're so proud of is that we started with ethnography. So when I say that, before we designed any code, before we designed any of our services, we actually invested time in understanding the problems that our customers, our olders, were trying to solve for. And I also think what's fascinating is we replicated this study not only in 5 sites inside the US of different locations, different socioeconomic groups, different ethnicities. We also ran this in India. And we found, of course, the metrics of the doorways of how you go into perhaps a healthcare system or how you go into a payer system if you're going through a payer system, the values and the wishes and the hopes and dreams were the same in that trust is the number one thing. If I'm going to let you into my home, or if I'm an adult child who's going to provide services for our olders, we require trust as the ticket of admission. And the second thing is really simplicity and inclusiveness. So what we've always committed to, and it sounds like you've done a great job of that as well, Kelvin and others on the panel, is bring them along. It's never that you are doing for them. We are doing this in a community. We are doing this together with our olders. We're designing together with our olders in order to make sure that it's going to work for them, be trustworthy, be simple, be straightforward, and always be passionate about the problems that they're trying to solve and therefore delivering. And that's why we have this both services as well as a concierge service that people can pick up the phone and talk to a person to get the things that they need delivered to their home and to enable them to live at home independently. Yes, sure, we use the tech, it's in the background, but we really want to preserve the time to be able to have that voice one-on-one with our customers, because we know that's also a part of solving the loneliness issue. And also, like you said, Kelvin, sometimes our customers just want to come and talk to us, and that's okay. They deserve to have that type of attention if that's what they want. Thank you.
Absolutely. Yeah. Jose, can I just add something?
Go ahead.
Yeah. So I call it the decoy because too often we design for the people paying the bill. And in our sector, who is the actual customer is a big question, because you can come up with something great, but someone has to pay for it. Obviously, unless you're a charity or you're Bezos or you've got, into like the philanthropist arena realm. So someone has to pay for it. And that's why there is this natural tendency to solve their problem as opposed to the problem of the user. Because it just doesn't make sense when I say, okay, we're going to solve your problem, but you're not going to pay for it. Someone else is going to pay for it. So this is like a trap that we normally fall on. And that's why you need to have that passion. Because one thing that you need to realize, this is not like punching code. This is about solving a problem for a vulnerable person. And that is something that you have to learn. And that is when you understand this, your whole approach would change. For example, none of my data scientists will start punching any code unless they've went out, they've met some of our clients, they understand the problem that they are facing. Obviously, they have their own grandparents, but we also want to take them out and talk to our users, our clients, listen to them, what they are saying to us in terms of their challenges.
Engineers are people too. They need to be inspired too.
That's a good point. That's a great point.
They need to be inspired. And we've got people, we haven't even started the after party yet. We have people lining up to get in. Should we start the after party 7 minutes early? Is that naughty? Or does somebody else want to add some?
Go for it.
I'm going to bring Vicky.
I can be naughty for the after party. So
Welcome, Vicky. I don't know you, Vicky, so I can't introduce you.
yeah. Hi, Jennifer. Hi, Jose. Hi to all of you. Thank you for having me here. So if I have a couple of minutes, I can introduce you, myself and grandmama. So a few years ago, my dear grandmother, named Stavrula, was living alone. She had an accident. She broke her hip, something really, really common at her age. She had a surgery, and for the next months, my parents took care of her. But I remember she kept saying, I want to return back home to the house where she got married, she raised her children, and her husband died. So we called an agency in Greece. And the very next day, we had a living caregiver. We didn't know her. She didn't know us. But we started to cooperate with her. The very last day of my grandmother's life, she got abused by her caregiver. So for me, grandmama is not just a business, but it is the impact that we have for both sides, for the older people, but also for the caregivers. So what we're trying to do is to give them the opportunity, both sides, to have a better quality of life, to be not to be underpaid, to be visible, and to help them to elevate all the services given to older people. So grandmama is a full stack AI powered care tech solution to support both families and caregivers during their home care journey, from matching to reporting safety and security, and managing all the care-related expenses. And so far, we have more than 11,000 vetted caregivers and nurses in our network, and we have helped more than 7,000 families. Now we're entering Kerala, India. We have soft launched with 4,000 candidates as caregivers to provide them seminars, trainings, and education. And in one hand, to serve the market because it is a booming one, and on the other hand, is to provide them with the opportunities of reallocation due to shortage of caregivers in Europe and US, Canada. So we're an impact first for profit startup, meaning that our network is mostly women over 41 years old, meaning women who cannot easily find a job, from 43 different nationalities. Half of them are immigrants and refugees. And this is what we're doing. And this is what we want to spread the message to the world, that we want to change and help and be helped to change the home care industry.
Thank you. Thank you, Vicky.
Thank
you for jumping right in. Usually people are a bit people are usually a bit shy at the 45-minute mark, but you dived right in there. And Mila, did you have any feedback or advice for Vicky?
No, I mean, caregivers, that's where Arun explained on our session as well. So caregivers, one of the major issue, Vicky, maybe that might be help you, since you bringing people around the world to support the Europe and the northern or western part of the world. So one of the major concern in terms of handoff document after everyday caregiving practices, recording observations, recording what are the practices they've been done, and working according to care plans. It all comes to more importantly, communication is the key. Doctors convey various information that need to be exactly observed in the exact way, and their practices are very important in many ways. So that's what Arun explained. So mostly the caregivers are non-native English speakers, so they have difficulties in terms of taking notes, updating that to the doctors in the caregiving environment. So AI plays a major role. Because even you throw anything to AI and it basically correct you on a formal way and make it more polished towards diplomatic discussions. So that's basically something, the front face of our platform, what Arun explained in the session, where basic writing, that will be completely in a medical writing with the exact terminologies what the doctors use. We trained from thousands of documents in the past to come to that particular conclusions, what's the exact meaning of it. So the gap between training is one area where caregivers and their policies, how they're supposed to act, how they carry the empathy, everything's supposed to be on a policy and standard that can be trained through AI. And that is another area we're working mostly. It's towards making it more diplomatic and making it more medical terminologies when they're communicating. So that's something we work on AI. That's elaborated by Arun.
Thank you. It's getting crowded
Daniel
up here.
has something to add on. Yeah.
By the way, the LinkedIn Live is ending, but we're going to the after party. Kelvin, I know you can't stay for the after party, or you're coming back later. I'm wondering, can you end the event, the LinkedIn Live, with a final word?
Yeah, I would say, remember, the older adults have made a lot of sacrifices for us today to have the future that we are enjoying. So always remember this. You know, they had to put up with a lot to give us the freedom, the health that we have today. So who are we to box them in the expiry box and say they don't matter anymore? They do matter. Because of them, we are here. And I will leave this on with you.
Thank you so much, Kelvin. I'm really glad you came on the panel today.
Thank you. Oh, pleasure to be here. Thank you.